Evening and welcome you all once again to this wonderful event today. And you're going to be listening to global experts, and it's indeed a pleasure to have our speakers from all over the globe. Let me introduce you to CAHO. Many of you know CAHO. You saw the anthem. It's the passion that drives this organization. CAHO is a not-for-profit society that was established in 2013. We are established to promote quality, patient safety, and accreditation in this country. So standards is something that we believe in. Standardization is something that's part of the DNA of CAHO. So we are extremely proud today that many of you could join us to celebrate the World Standards Day. To all those who are here, we are aware that the World Standards Day is celebrated every year on October 14th. So we are going to be celebrating it a little earlier. And what is the purpose of celebrating World Standards Day? It's all about bringing together and to spread awareness on standardization. And it's to bring partners together and to standardize the service, the product, and the service delivery to the clients. So it's indeed a great privilege as we are going to be discussing about the Sustainable Development Goals 3. And the theme for this year on World Standards Day is about shared vision for a better world. So we are all together with our shared vision for a better tomorrow. So we have with us many experts, and I don't want to stand between you and the experts. They'll be sharing about the latest standards, the ISO 7101-2023, and it's been a great experience for all of us here who worked relentlessly for almost 3 years, led by Professor Adam Layland and Angela. And we are indeed very privileged to be part of this global committee, the team that sat together and developed the global standards for the globe. So this is from the globe to the globe and to the people of the globe. It's indeed a privilege to be introducing to you the speakers. I will introduce them one by one and hand over to them for their thoughts and what they think these standards are going to be. How are they going to be benefiting the globe at a large? Now, let me take this opportunity first to introduce to you our own Angela. She is a MSc, she's a global healthcare leader. She's a registered nurse practitioner and a project lead for the Work Group 5 ISO 7101-2023. She wears several hats, and it's good that we listen to her and learn out of her experiences from the global arena. Over to you, Angela.
Thanks, Dr. Lallu. Yes, as she said, my name is Angela. I was fortunate enough to be the project lead for the new ISO 7101 healthcare quality standard. I have a background in auditing and implementation of quality systems. I'm also a registered nurse and I would say a clinical specialist and an expert in global health. I work on a global scale. So thank you so much, CAHO, for hosting this event. The first time we speak about ISO 7101. The creation of this standard started, it's been a 3-year journey around the world through multiple time zones, across cultures and economies, and among varying models of healthcare system delivery. The work group, I think it's important to know, that created this standard, they're very unique. They are WHO consultants. They are ISQA fellows and experts. They are directors of hospitals, directors of quality and risk management. Our team had representatives of ministries of health, professors from prestigious universities, and researchers. And it included both public and private or nonprofit sectors. As you know, many of the healthcare standards that we find these days have been created more by your Western nations. So it was really important to us that we include many voices and viewpoints from the global South, so it would be a truly international standard. Some of these countries included Malawi, Ghana, Cameroon, China, Brazil, and India. These are just some examples. There were many more countries, but that's kind of the global South representation. I've never been in a group of more committed professionals who are more passionate and have more expertise than this group did. I will be forever grateful for the experience. And it's in this spirit that I ask when you do read this standard that you know that every word, every thought, every decision that went into this standard was carefully thought out and agreed upon by a global chorus of voices. Couple last things that I just wanted to mention that makes this standard really special is that it not only addresses effective, efficient, timely, safe, and people-centered care, but it's the first ISO management system standard to include the new requirement for addressing climate change, the very first one. And we boldly decided to mention the United Nations Sustainable Development Goals against what many people wanted. So that's very quite unique. So I'm going to hand it over to the experts. And I just really hope that you enjoy learning from this work group who made the standard a reality. Thank you.
Thank you so much, Angela. I fondly remember the good times together, though it was through Zoom. And I remember Dr. Anuradha, me, and Dr. Rana joining at 11 p.m. midnight, and probably Shin joining at 5 a.m. in the morning. So, different time zones, beautiful experience sharing, but we enjoyed the culture together. Indeed, a great experience, I must say, working with people from different countries. And thanks for giving us this opportunity. Now, I'm going to hand over to our own Dr. B.K. Rana. All of us know him very well. He is the CEO of the Quality and Accreditation Institute. He was part of the Work Group 5 as an expert, the ISO 7101-2023 standards. And that's the one that we are going to be speaking about in great detail in the coming presentations. Over to you, Rana sir, about the overview and the Quality and Accreditation Institute.
Thank you very much. Thanks, CAHO, for having us all together today, celebrating World Standards Day. And thanks, Angela and Adam, for leading the project. As Lallu mentioned, I have been fortunate to be part of ISO TC 304 Working Group 5, who actually developed this set of standards. And I think this is the first opportunity for everyone around the world to get an idea of the outcome of the work for last 3 years. I'm going to touch upon the outline of 7101 and role of QI as we envisage in time to come. So, as the title says, ISO 7101, published in 2023, very latest addition to ISO set of standards with the title Healthcare Organization Management, and in particularly management system requirements for quality in healthcare organizations. And when we say requirements, these are the meaning that any organization who is going to adopt, they need to meet these requirements. There are not options. The options are only when the term shall is not used. If people who are aware of ISO terminology, if a standard mentioning shall, it means it is a requirement, it is a must do. If it is should, may, then there are options, then you can choose or you not to choose. But if it is a shall, it's become a requirement. And what this standard talks about? This standard provides requirements for management systems for quality in healthcare organization. And as Angela mentioned in his opening remark, this is the first set of ISO standards developed for quality in healthcare organizations. There have been several other standards existing as a mother document like 9001 for quality management system of all type of organization, but this is very specific to healthcare organization. It is applicable to any healthcare system, any type of organization or entity which aims to improve quality of its healthcare delivery and outcomes. And such institutions may come from government, private, maybe charity, non-profitable, profitable, in a hospital, clinic, blood bank, any type of organization can fall into the domain of these standards. And that is the beauty. That standard has been developed keeping all possible type, I would say. Maybe some may exist tomorrow, which may be different, but all possible types of healthcare organization can utilize these standards to develop their own quality management system. Now, in terms of overview, this document contains the requirements used to assess conformity. So conformity means then when any auditing is done on an organization, how much standard is complying to the requirement of this standard. That's called conformity. The conforming to the requirements is conformity. So this standard is very well used, and that's why this standard can be used for certification. Any organization that wishes to demonstrate its conformity with this document, which means ISO 71001, can do by 4 following options. Making self-determination and self-declaration. So this is just you do yourself that say, okay, I am complying with this one. This is like self-voice, self-proclamation. The second option is seeking confirmations of its conformity by parties having an interest in the healthcare organization. So whosoever can have interest in the healthcare organization means it can be the service users, the patient, the doctor, the hospitals itself, or maybe the regulators, maybe insurance companies. They have interest in the healthcare organization businesses, so they can also use this standard for conformity assessment. Third option is seeking confirmation of its self-declaration by party external to the organization. It means someone who has no direct interest with the organization can also utilize these standards for carrying out assessments. Then the fourth one is seeking certification or registration of its management system for quality in healthcare organization by an external organization. And this is actually the core of the standard, which is actually third-party evaluation system, which is globally used as a certification, where the third-party agency comes and evaluate any healthcare organization, having no interest in the organization or its business, having no interest in its clients. Like for example, in this case, the patients, is become totally independent, unbiased third-party evaluation system, which called certification. And this is the most sought option for many of the healthcare organizations to demonstrate their commitment to the compliance to the requirement of ISO 7101. Now, what are the contexts in there? There are several clauses and sub-clauses given the standard. Is a quite big document, but quite easy to comprehend. When you go through the standard, and you will come to know these standards says what you actually do every day in your organization, but more systematic way. So in all, there are 7 major clauses, because in ISO, we define a standard into clause and sub-clause. So there are introduction, the scope, then the terminology, and then the fourth onward, there are the major clauses which prescribe the requirements for healthcare organization. The first clause number 4 is says context of the organization, which means what type of organization is using this standard, what are the needs of stakeholders they have identified, and what are the activities they are performing, like hospital, like blood bank, imaging center, or a clinic. So they have to define what activities they are carrying out in that organization. So this is to set the context as an introductory part of the standard and the organization. Then the next clause 5 is about leadership, the management. What is the commitment of the management or the leadership to implement the requirement of 71001? Because commitment from top is very, very important for the success of any implemented standard. Otherwise, it just becomes a paperwork. Then it talks about quality policy. It talks about roles and responsibilities at the leadership level, and then focus on service. That the leadership, the management actually is committed to provide quality services through a commitment through the quality policy, which they have to define. The next clause is planning. It means how the services are planned within the organization. What are the risks and opportunities available to the organization to identify, make use of them to improve? What are the quality objectives set? And these quality objectives are also linked with the quality policy. Whatever quality policy you define, that your quality objectives should be in alignment of the quality policy. And planning for changes. If any organization plan to make any changes in quality management system, how it plan that and how it execute those changes in time to come over a period of time. The next clause is about support. Support means in terms of resources, what resources you need. Any organization has to provide adequate and required resources in terms of man, machine, environment. What equipment you need, what human resources you need, what environment you require. That comes here. The competency, the competence of the people who are working, the doctors, nurse, paramedics, biomedical, any healthcare worker which is working in the organization has to define the competency of qualification, experience, skills. Then communication form a very important and integral part of the standard. Internal communication as well as external communication. And then how the information is collected, stored, retrieved, disseminated, and disposed of. All sort of processes within the information. The next clause is about the operation. And this is the largest clause in the entire organization. Why? Because this is the most important clause in terms of services being offered, the clinical services being offered in the organization. How the service provider operate. It's about planning of services. It's about facility management, the building, how the infrastructure is maintained to ensure safety, quality, all those things come under facility management. Equipment maintenance, inventory, calibration, maintenance plan, everything comes under that. Waste management, very important, including biomedical waste. Handling rules and regulation has to be applied. Then handling of various type of materials which comes to the hospital, whether medical and non-medical supplies and services. Sometimes services are outsourced. So if services are outsourced, supplies are outsourced, then what is the criteria hospital or organization has to use for accepting those in place? Then what are the service provision? What are the service you are offering? How you are making sure they are delivered as they should be delivered? And most importantly, it's people-centered care, which means patient in the center, family around, and community on the periphery of that. It's not just treating a disease in person. It is about everyone involved. Everybody has to be involved for the better outcomes. Ethical aspects for delivering services. Patient safety. And patient safety include medication safety, injection safety, blood transfusion safety, hand hygiene, infection prevention control. All those comes into the patient safety aspect. Then workforce well-being. COVID-19 has taught us lessons, and that was specifically discussed in the working group, that how we make sure that the staff working in the organization remain safe. If the staff is not feeling safe, they will not deliver the safe care to the patient. And that was the reason we put a very good emphasis on workforce well-being, and also how the ergonomics of sitting arrangements, lighting arrangements, all those things are taken care of. Then clause 9 is about performance evaluation. Any system is incomplete without evaluation. How anybody will demonstrate that they are improving or they are not improving? For that, there should be a monitoring mechanism based on measurement, analysis, and evaluation. And what is to be measured? Indicators. So there are clinical indicators to be defined. They need to be measured. They need to be analyzed. And analysis should lead to evaluation of the function. And then internal audit. Very strong tool for any management system is internal audit. Self-check, self-evaluation, self-assessment. Check the requirements where you are. And if there are any gap identified, you take action to fill those gaps. And then overall management review. The leadership, the clause 5B, what I was talking about, should know what is going on in my organization. And that should come through the management review meetings on a defined regular interval where every reports come to them, and then they review and make decision about that. Last but not the least, clause 10 is improvement. After all those things, there should be improvement. If there is no improvement, there is no purpose of any standard. So how we see that? Continual improvement on a ongoing basis. Improve, stabilize, improve, stabilize. That's the staircase, staircase model, continual improvement in comparison to the continuous improvement. Then management of non-conformity. Any system is vulnerable to any defect or any non-conformity. We cannot say any system is perfect. No system is perfect. There may be some gaps. If there are, they should be identified. They should be addressed. Proper corrective action should be put in place. So this is in all the major clauses of ISO 7101. Now, way forward for QI as an accreditation body, as we are offering accreditation program for last 6 years. We have a bouquet of services. Already 14 programs are already being offered under Center for Accreditation of Health and Social Care within QAI, related to even hospital standards and everything. In general, healthcare accreditation bodies develop their own standard. But when there is a standard coming from the international arena, that can be make use of. So what we see our role in time to come, an addition of a new product to QI menu under CHSC. QI accreditation using ISO 71001 2023. So we plan to use this as standard for accreditation of healthcare organization, but we have to be careful that these standards are general standard applicable to, as I mentioned in the opening, any type of organization. So there may be a need to develop a specific supplemental criteria in relation to 7101, particularly but not limited to clause 7.1, which is about resource, 7.2 about competence, 8.21 about facility management and equipment, because it may be different from a blood bank to a imaging center to a hospital to a clinic. The competence may be different, management may be different, equipment may be requiring different and methodology. So these things can be developed as a piece of supplementary requirements. And of course, like this is the first program on 71001, it is important to create awareness. So we would be creating awareness programs, conducting awareness sessions, and most importantly, to talk about the standard in detail. We plan to do DIVE. DIVE means documentation, implementation, verification, and elevation. You should document the requirement of 71001, start using them, implement them. Then somebody should check internal audit or external verification. Elevation means improvement. You should show improvement through that. So this is what we plan to do at QAI using 7101, which is the first healthcare quality management system standard come out by ISO. And I have been fortunate to be part of this ISO TC 304 Working Group 5, led by Angela and Adam, with my colleagues from around the world. So thank you very much for giving this opportunity to me on talking about the framework of ISO 7101. Thank you very much.
Thank you. Thank you, Dr. Rana. As always, you made it very, very clear. And I'm sure our participants will appreciate that. Let me give a small overview again about the World Standards Day. 14th October was specially chosen to mark the date in 1946, when delegates from 25 countries first gathered in London and decided to create an international organization focusing on facilitating standardization. Even though the ISO was formed a year later, until 1970, it was not formally approved as the World Standards Day. And the first time it was celebrated in 1970 as World Standards Day. So that's a small history about the World Standards Day. And we have now a person, a very, very interesting person, who's going to be talking about how he is going to do it in his country and the continent. Dr. Carlos Hiran de Souza. He is the CEO of the Accreditation Pathways Institute from Brazil, Portugal. He was part of the Work Group 5 expert ISO 7101-2023. I fondly remember the way Angela and Professor Layland used to moderate the sessions. We were experts from all parts of the world with our own ideas, views, expertise, and that had to be moderated in a way that we come to some consensus. A particular word will be deliberated for over 1.5 hours to come to a particular meaning, the right meaning. And I think we did it all very, very well. Not an argument. And the way it happened, it was a great learning for me as to how we can bring about consensus. And if we are able to achieve this, I'm sure we will have no wars at all. So I'm going to hand over now to Dr. Carlos for his thoughts. Over to you, sir.
Thank you, CAHO. Thank you to CAHO and to Lallu for your kindness, and also Anu for your great reception in CAHO for us. I am a medical doctor, and I am master in public health, and I work for ISQA as expert and a surveyor, and also as a surveyor, a lead surveyor for the European Reference Center Network in the European Union as well. And it was a great pleasure to be part of this work group 5. But I would like to start. Thanks to BK, because BK is a great friend and it was a great leader for us, and he facilitated my presentation, to be very honest with you, because he talked everything I would say in 5 minutes. So I still have 5 minutes to talk. So let me try, BK. Thank you very much. So BK did a very good outline of the standard, and I'm sure it was very profitable for everybody. Thank you for your audience as well. We have now 242 people looking at us around the world, so it is a great pleasure to be here. And I would say, what a beautiful day, really beautiful day. Finally, as Adam said once, there is a new ISO standard for the world, by the world, that has the potential to improve healthcare delivery systems and patients' health outcomes and well-being throughout the world. Well, this is a special day indeed, as we can meet once again with our beloved Working Group 5 and have this opportunity to express our intentions to continue working with healthcare organizations in our countries, and of course, contributing to the whole world. And for my part, I would like to thank Angela, Adam, and Nikki for their strong leadership of our group. And it was indeed an effective work that was crucial to the results we have achieved with the publication of the ISO 7101 standard. Well, my participation in this 27-month journey was with the group that developed the clause 6, specifically the topic of risk management. There we emphasize the fact that organizations shall consider planning and act to address risks and opportunities for the risk culture and risk management processes, while giving assurance that the healthcare quality management system can achieve its intended results, preventing or reducing undesired effects, achieving continual improvement, and above all, evaluating the effectiveness of these actions. I do believe that the ISO 7101 2023 standard provides important guidelines and challenges in all the topics it addresses. In terms of our collaboration as experts and developers, I think it has broadened our scope for evaluating quality systems in healthcare environment, but it has also added value for a better understanding of the realities of these systems. In my opinion, all of us who took part in this journey of great learning, as Lallu said, are now fully able to share this experience with organizations that are willing to apply these standards in their projects for change and continuous improvement. Well, I am the founder and CEO of the Accreditation Pathways Institute in Portugal. This is a transnational knowledge support agency for organizations at all levels of care, mainly focused on the continuous of care delivery. Well, our core activities are training, design of care process, consulting and coaching for care management, but also supporting healthcare organizations to better manage their quality programs and their preparation to achieve national and international certifications and accreditations. We believe that doing this, we are contributing for a better health. And I do work in Brazil and Portugal, and we started our activities here in Portugal. I have to say that it was very important, my past experience with accreditors organizations like CHKS, like OTCHI, like other national organizations in Brazil, Rana, and this was very important for me to get an international experience during all this time I worked as a quality professional. And it will be an honor for us to be able to contribute to Portuguese and Brazilian organizations in their understanding and use of the ISO 7101 standard, not only to achieve the certification, but also to make their programs more effective in improving the safety of the care they offer to their patients. Well, as I said, I don't need to do another outline, but I would like to introduce myself and say that I am more than happy to be part of this moment in the world. And I truly hope that the ISO 7101 standard will add value to healthcare worldwide. And I must confess that I am very, very proud to be part of this history. And with this, I have to say thank you so much to listen to me. Thank you, BK, once again. And I am going to give my short time to the next one. I think it's Shin. I don't know exactly who is going to be in my sequence. Thank you very much. Thank you all, and let's do the most beautiful thing that we do in our job. That's the beauty of our job, to be together, to share our experience, to learn with each other, and to pass by the world our experience. Thank you.
Thank you. Thank you so much, Dr. Carlos. Indeed, a pleasure listening to you. You are such a motivation, let me tell you. And this day is for all of us. This day honors the efforts, or October 14th rather, honors the efforts of the thousands of experts who develop voluntary standards within standards development organizations. So we were all part of this history. We will continue to be part of the history. And Pichumani next, my own friend, a great friend of mine. We are partners in crime in the organization, the Consortium of Accredited Healthcare Organizations. Dr. Anuradha Pichumani, she's the chair of the Quality Professionals Wing of CAHO. She's the executive director of the Sri Ranga Hospitals, Tamil Nadu, India, ISQA expert herself, and part of the work group 5 expert, ISO 7101-2023. Over to you, Anu.
Yeah, thank you, Lallu. Introduce myself. I'm a OBGYN consultant, executive director of the Sri Ranga Hospital here in India, in southern India. It is in a semi-urban area. And I've been collaborating on patient safety and quality with various organizations as chair of the Quality Professional Wing of CAHO and as principal assessor of NABH. And I work on various quality projects with Harvard, and also as a member in the Asian Society for Quality and also in the International Society for Quality. So we have had various healthcare quality standards, which are internationally and nationally recognized. But ISO 7101, the 2023 Healthcare Organization Management Standard, this is the first standard which is going to be applicable for any type of healthcare organization across the world. And this technical committee, 304, the working group 5, this was established in 2020 to write these standards. And these work groups are usually formed by experts who are nominated by their country's standards body or from ministries of health, and also the International Society for Quality, the ISQA, the WHO consultants, and the various leaders of patient safety. So we all are very happy and honored to have been nominated to write down these standards. And again, thanks to Adam and Angela for having led this work group 5. Again, diversity is the core of our work group. And we have had all members, as you see here. We have members from various countries, Nigeria, Japan, India, UK, you name the country, we are here. And we have been representing the various identified income categories too. And in work group 5, I was part of the content writing for 3 of these standards. the people-centered care, the governance, and the risk management. And today I would like to discuss with you all some of our thoughts which we had in our expert group in creating the standards for the people-centered care. So moving on, this whole standard, this document was created so that the organizations will have to deliver high quality healthcare. So this standard will create a culture of quality along with a strong top management, identify and address the risk, ensure patient and workforce safety and well-being, have a good documented process, monitor and evaluate all the clinical and non-clinical performances inside the organization, and continually improve its processes. So these standards will help every healthcare system, which will be based on the people-centered care, respect, compassion, co-production, equity, and dignity. This is the aim of writing this 7001. And when we talk about people-centered care, the inclusion of people-centered care is one of the unique differentiator of this ISO 7101 compared to other standards. And as we all know, people-centered care is providing care that is respectful of and responsive to individual needs, preferences, and values. So this people-centered care will have a formal process for systematic participation in the quality management activities. Again, this standard will promote an enabling environment for engagement of people who are in our care. It will also have a formal process to elicit feedback and experiences that will reflect the various social and cultural perspectives of our community. And again, these standards will look at all the patients and families as participants as well as beneficiaries of this healthcare system. It will ensure that all voices are included, be it the underrepresented, the vulnerable group, or the stigmatized group. So this is the reason why we are concentrating on the people-centered care. Moving on, we have the respecting the voice of customer, which is very important, which will ensure the better value for money for both the patients and the stakeholders. So to include the voice of customer, we have these standards which include these various topics. And I'll be discussing on these 5 topics which are there in the standard. The first is the service user experience. Second is the compassionate care, the inclusivity and the diversity, the health literacy and co-production. So all these are very important, more so for resource challenge setting, the third world settings. So to learn them about them in detail, the service user experience, which is very beneficial, and the organization will have a validated and reliable methodology to check the service user experience. It will have assessments of family and caregivers, and also it will include the voice of the community groups and the external customers. And to improve the patient experience, we will be checking whether the hospital treats the customers, the patients, with respect and kindness, whether the emotional and social needs are taken care of, whether the organization is maintaining privacy and confidentiality of the patient, and whether all the people are treated equally. This is very important because we are going to keep the person first. It will also include various action plans, which will address the negative experiences where you might need to change certain processes and you might need to do certain follow-up communication also. You might be able to use the user experience data to improve your own clinical outcomes and to improve the services, to see whether your adherence to treatment protocols are being done, and to improve the staff satisfaction also. The next part is about the compassionate care, which is indispensable when we are going to talk about people-centered care. So this 7101 will have processes in place to treat patients or customer with respect and dignity, to foster and promote an environment of kindness among people, families, and caregivers. We'll be listening to patients and caregivers, and also the standards will help you to educate your staff on how to deliver the compassionate care. The third part is about inclusivity and diversity, which is very relevant in people-centered care. So the standards will help you to adopt principles of cultural competence, align the services to improve the equity of care, and value diversity to reduce disparity. So it is for all persons of various color, the genders, beliefs, languages, literacy, racial, ethnic minority groups, and all other vulnerable population which are available across the world. So we are going to ensure that there is no bias, there is no disparity, which will influence the staff interaction or during the decision making. It will have various processes to capture cultural competence, feedback, and opportunities for improvement. Again, talking about health literacy, this is central to any people-centered care because you need to empower your own patients and caregivers to improve the health literacy so that they participate in their own care. So the standards will help you to integrate the health literacy into planning, evaluation measures, improve the patient safety, communications, and quality improvement. The standards will educate the workforce to be health literate and also will help you to monitor the progress too. So you are going to address the health literacy in various high-risk situations, be it during informed concerns or care transitions or communications about medications. These are various high-risk medication situations which can occur in an organization. So you need to take care of the health literacy so that you need to focus on the ability of the patients to make a well-informed decision during their own care. Again, co-creation or co-production is a valuable addition to any healthcare services, and it makes it more relevant to people-centered care. So in co-production, you're going to empower the patients and families to become active in the care, pay attention to patients' lived realities, because these lived experiences are very important, going to take care of the values, the resources, and the social systems. You're going to create a shared decision-making environment, take care of the top leadership, whether they are creating an enabling environment to co-create. Foster the patient's autonomy, identify outcome measures that matter to the patient. These are the various things we can do with the co-production in ISO 7101. So to move on, the healthcare management standards, which has integrated a people-centered care. This has huge benefits both to the patients and to all the stakeholders. It can be an improved access to care. It will help in improving the clinical outcomes, have a better health literacy, improve self-care, improve satisfaction, improve efficiency of services which the healthcare provides. It will reduce the overall costs, so improve the efficacy also, and improve the job satisfaction of all your employees. So ISO 7101. So this concentrates on all the sustainable goals. So the SDGs are taken care of, and on the World Standards Day, this showcases the many ways in which the international standards contribute to the success of the United Nations Sustainable Developmental Goals. So the SDGs are a call to action to end poverty, to protect the planet, enjoy peace and prosperity. This is all the more essential at the present times to create a sustainable world. And 7101, it helps you to improve on the SDG 3, which is on good health and well-being. You have a shared vision for a better world. And this 7101 helps you to have a high-quality health system, safer healthcare, and people-centered care. So let us all be united to have a shared vision where the health and well-being of each individual is cherished and safeguarded in the world. Thank you all, and thank you for the opportunity. Have a great day. Bye.
Thank you. Thank you so much, Dr. Anuradha. It's the shared vision for a better world, incorporating SDG 3. That's the theme, and you said it all. This theme reflects our shared desire for a fairer, more sustainable world with a very strong focus on the health and well-being of all. It harmonizes perfectly with the Sustainable Development Goals. It's a global initiative promoting peace, prosperity, and the welfare of both people and the planet. These SDGs are not just aspirations. They are urgent calls to action, requiring the collective commitment of nations and individuals. We are certainly in this together. The world is watching. It's our responsibility. And to talk more about the session.
Thank you very much.
She needs no introduction to the Indian audience.
No need.
Part of the CAHO. He's a member of the International Advisory Committee of CAHO as well, a very renowned person. And I hand over to you, Shin, for your talk.
Okay. Thank you very much, Lallu, and thank you very much, members of this seminar, and thank you very much for attendees for including me. I'm Shin Ushiro. I'm talking from Japan. I am really honored and privileged to be a part of this project led by Angela and Adam. Those two persons are really excellent. That's why I joined this project very early in the morning or very late at night, having sushi and taking a shower and brushing my tooth with toothbrushes. So I joined this project from everywhere, from my home, from train, from my office in the hospital. So I like this project because people are really passionate to produce a new standard within 3 years. This is the rule of ISO, and we were successful in completing this new standard within 3 years since we began this project. And in the first place, I would like to tell you that I work in a hospital, and I also work in JQ, Japan Council for Quality Healthcare, that provides hospital accreditation service. So I am working in 2 different positions. One is to provide hospital accreditation service. Another one is to undertake hospital accreditation survey. To be very honest with you, my hospital went through hospital accreditation this July, the end of this July, and now we have got interim report from JQ. So and we were successful to identify several points for improvement for the year to come. So we realized that it is very helpful for us to take external evaluation. And I also work in Japan in International Society for Quality Healthcare, dubbed as ISQA. And ISQA once asked me to join in this joint project with ISO. And I was happy, as I told you, I was happy to join this project. And I worked with many esteemed colleagues. And at this point, I know that it works very well. I'm talking about 9001. I know it works well for quality improvement in hospitals, but in my country, in terms of ensuring leadership, in terms of documentation, in terms of policy development, in terms of PDCA cycle implementation, etc., etc. But I also thought that it's a standard. 9001 is a standard for quality management rather than safety assurance. So my passion initially was to incorporate patient safety element into 7101 in the new project. So we finally were successful in having several items, several dimensions closely related to patient safety in 7101, such as patient identification, medication safety, and surgical safety, infection prevention and control, prevention of falls, pressure ulcers, and thromboembolism, dubbed as VTE, and diagnostic safety, blood transfusion, etc., etc. So I hope hospitals, medical institutions will undergo, will go through both ISO 9001 and 7101 to promote quality and safety improvement. At this point, I'd like to share with you the accreditation status in my country. In the first place, I'd like to emphasize that in my country, hospital accreditation is mainly provided by JQ, where I work. But there are a small number of hospitals accredited by ISO and Joint Commission International, JCI. And we have more than 8,000 hospitals in my country, and nearly 25% of hospitals are accredited. We accredit relatively big hospitals with large number of beds. So if we standardize the accreditation rate to hospital bed number, the accreditation ratio of accreditation ratio will go up to more than 40% if we normalize the ratio to the number of beds. I mean. But there is some challenges. As I said, we JQ have accredited relatively large hospitals. So if we look at a small hospital with only 100 beds or 200 beds or less than 300 beds, accreditation ratio is very low. For instance, only 7.9% of hospitals with less than 100 beds are accredited in my country. But please note that there is a different system like accreditation, which we call inspection by the government in my country. But inspection by the government is not education. It's just a confirmation of minimum requirement. So there is no element of education. There is no element of improvement in inspection. So we like accreditation, and we have been promoting accreditation. But in smaller hospital, we don't know about the quality in smaller hospitals in my country. So together with ISO 7101 and hopefully 9001 as well, I would like to see more hospitals regardless of the size of the hospital, to be accredited by external evaluation bodies. And yes, and the good news is that I'm working in university hospital with more 1,000 beds. And the good news is that the government mandates a university hospital, like my hospital, to be accredited by a third party. It's an obligation for university hospital. University hospital accounts for only 80 or 90 hospital among 8,000 hospital in my country, but they are very overarching, influential. So maybe this mandate will grow, will be bigger in the near future. So I hope in the near future accreditation will be a mandate for a larger number of hospitals in my country, and accreditation should not be necessarily provided only by JQ. JCI, ISO is our friends of JQ. So I hope more larger number of hospitals will take accreditation from JQ, JCI, or ISO. And last, I'd like to mention incentive, financial incentive on accreditation. What do you see here is very complicated slide, but it explains our healthcare payment system in public healthcare system in my country. The payment is composed of prices of individual procedure or a laboratory test or surgery or anesthesia, etc., etc. Each procedure or those things have individual price, and there is a price book composed of 2,000 pages, and some items is closely related to hospital accreditation. So in short, if you get accredited, you will get more money. That is what is going in our hospital healthcare payment system. But what the items you see here is relatively for larger hospital. So smaller hospital is not. It's a little bit difficult to obtain these payment items. So together with the ISO and the JCI, on behalf of JQ, I would like to expand the items closely related to external evaluation or accreditation in the near future. So ISO 7101, launch of 7101 is is providing a good opportunity to work together with ISO, in my view. Okay, that's the end of my talk. But my message is again that I hope that more hospitals will be accredited by JQ and ISO 7101 and 9001 in the wake of the launch of 7101. So thank you very much for listening. Thank you all. That's the end of my talk. Thank you. Back to Lallu.
Thank you. Thank you so much, Dr. Shin. I mean, it brings a lot of parity. I think all of us have the same problem. We have more than 60,000 hospitals in our country, with just over 4,000 hospitals that are either accredited or certified. So there's a great need for global standards. And unless we really embark on this journey of accreditation, we will never be able to benchmark and see where we stand. And particularly the concept of healthcare payment system and accreditation is quite interesting. And I think there's lots to learn from you. So let me take this opportunity to invite all these global experts to our upcoming CAHO Con, which is in the month of April 4th, 5th, and 6th. Sorry, 5th, 6th, and 7th at Calcutta. So it will be a great learning opportunity for all of us. And if all of us can get together, learn from each other, the world will be a better place, I'm sure. Thank you so much, Dr. Shin. And now let me hand over to Dr. Elom OTCHI for his.
That is needed is the fragility and the weakness of our health system. So next slide, next. So when you look at this graph, for instance, this is work that was done in one of the African countries. You will see that for all the health systems building blocks, there are inherent weaknesses along all the health systems building blocks. The only one that is that seems to be doing well is the partnership building block. This is similar across the countries. So this is why the standard is very necessary, that the standard helps in ensuring that the building blocks are very robust and strengthened so that they are able to provide quality of care outcomes. Next slide. The other reason is that when you also look at our health systems, the care that is provided is suboptimal and it is inconsistent with all the dimensions of quality as proposed by the WHO, as you are seeing in this. So one of the key is that for this standard, it addresses all the dimensions of quality. There are standard elements for safety, timeliness, efficiency, and all the other dimensions of quality. So it makes it very relevant and necessary for African health systems. And once this standard is implemented across the health system, I am very sure that quality of care outcomes will be optimized, because then care will be provided along all of these healthcare dimensions or quality of care dimensions. Please, let's go to the next slide. Next. So I've talked about the suboptimal poor quality of care outcomes. Next. Next. And then, I mean, funny enough as well, in our part of the world, not many of the health facilities have international accreditation. I mean, if you look at the countries, there are countries where there is even no hospital, either public or private, that has any international accreditation. The other worry is that because of the fragility of the health systems, when the accreditation is attained, the sustainability becomes very difficult or impossible. So that is a challenge. The other necessity is that if you look at the graph you are seeing, it portrays the level of variation and variability in our health systems. And this can be even extrapolated beyond Africa. So the standard ensures that there is consistency and some level of standardization in the way care is provided. So if we opt for it, it will address the issues of variation that is occurring. I mean, you take an indicator, for instance, like maternal health, and you see variation of maternal mortality across countries, both in the African region and in other parts of the world. So the issue of variation is also addressed by the standard. And that is a key consideration and one of the key reasons why we should be considering the standard. Please, next slide. Yeah, next slide. So I've talked about the variation. Next. Good. The other is that when you take the standard, it is both process and outcome oriented. So, and it is not specific. No, please go back. It is not specific to any product or any service. As far as the healthcare industry is concerned. So that makes it very important. No, please go back. And the picture you see also in its approach and application, and it is possible to reach the desired.
Dr. Elom, you're on mute.
Stakeholders who develop the standard. When you look at the picture you are seeing, you see that the people come from various backgrounds, various races, various countries. So their rich inputs and their rich experiences informs the standard. So this makes the standard applicable, and it makes it possible for us to use the standard in anywhere and in any part of the. So that is very key. So the diversity of the people who develop the standard and its applicability across countries makes the standard very user friendly and very applicable in our settings. So it can be used in rich nations, poor nations, very poor nations, and etc. So please go to the next slide. And the other unique thing about this is the emphasis on patient safety, which one of my colleagues have mentioned. But the other catch is that when it comes to patient safety, the standard complements the efforts of the WHO in implementing the global patient safety agenda. So that is very key as a requirement because of the various harm, the preventable harms that occur in our health systems, also particularly in this part of the world. And there is also the consideration of the Sustainable Development Goals, which the standards also complements the efforts in attaining the SDG. Please give me the next slide. And the other has to do with issues of climate and climate change. When you look at our world today, so that is a very important consideration for us to look at the recent standard. And this is very applicable in our context here on the continent, and then I'm sure in other settings as well. Please give me the next slide. So in conclusion, I mean, quality is not a given. It takes vision, planning, investment, compassion, meticulous execution, and rigorous monitoring from national level to the smallest, remotest clinic. So that is key. And I am sure that is what the standard offers, that it is applicable in any kind of healthcare setting and in any size of facility. There are standards, and some of my colleagues have given some details of the standards, so I will not belabor that point. So that is what makes this very unique. And when we are able to use it, we are improve upon our facility care outcomes and our national care outcomes. Please give me the final slide. So the call to action is that we should all embrace it, we should all welcome it, and we should all work with it so that by 2030, the improvement in healthcare outcomes will be universal, so that we in Africa and other lower middle income countries will also say that truly and indeed our health systems and our healthcare has improved because we have embarked on the use of or the implementation of quality standards. Thank you very much. Over to you.
Thank you. Thank you so much, Elom, for that brilliant talk. We certainly want to embrace it. It's unique. It's for the globe. It's for everyone. And thanks for bringing that to the light. Now let's hand over to the leader. Leadership is the capacity to translate vision into reality. And that has happened. A leader is one who knows the way, goes the way, and shows the way. You certainly did that, Professor Adam Layland, the convener of the work group. We enjoyed working with you every minute, and we carry wonderful learning as to how to lead such a large group, a varied group across continents, and you did it in style. So let me hand over to you now to tell us what is the way forward. Over to you, Professor Adam Layland.
Thank you, Dr. Lallu, for that really, really humbling introduction. And how amazing is it to see all of you experts and all of those listening to the wonderful speakers that we've had as well. It's my great privilege to be here to talk to you and to kind of summarize a little bit of what we've heard and really give that call to action. And what a day to do it on, with World Standards Day 2 days away. And celebrating the launch of the world's first healthcare quality standard. That is just an incredible accomplishment. And there's all the experts on the call that we've heard from and everybody that's been involved in that standard development. I'm so grateful for, and I've learned a lot from everybody as part of that. And a huge thank you to CAHO. I want to sing the song now, CAHO. I think absolutely amazing video. And thank you to CAHO, to the QAI, the African Institute, and the Japanese Institute for Quality as well for being here and supporting today. And a huge thank you to my great friend and who was our project leader, Angela, for her inspiration following her master's of coming up with the need for a healthcare quality management system standard for the world. So thank you, Angela, for sparking all of this initially as well. We're extremely grateful, and there's everybody in the world is going to be a recipient of your inspiration and your work as well, and as well as everybody's contribution to developing the standards. So huge thank you, Angela, for that. And as has been mentioned a few times, the working group was an extremely special moment in my life where we brought together people from every habitable continent on this planet with a passion and a motivation to improve healthcare around the world in every country that we can touch and across the 8 billion people that are on this planet we call Earth. And as Angela said at the beginning, this standard, ISO 7101, is the voice of experts who have volunteered their time freely to improve healthcare in every corner of the world. And it's so important that we've done this. It's been a long journey. It's had ups and downs, but the best thing about it is we've been together and we've been passionate as individuals to develop the standard. But it's really important because we've got an ongoing triple threat to healthcare in the world. We have got decreasing finances everywhere. Money's really tight. Healthcare needs more money, but financially, we're not able to afford that in the way that it's needed. We've got workforce challenges. The World Health Organization estimated by only this year there'll be an 18 million person shortfall of healthcare workers around the world. That's only going to increase even further. And we've got increasing demand for our services. That was before COVID, but post-COVID world has really increased the demand that that healthcare needs to give. And just in the hour that we've been together, over 16,000 people have been born in this world, and over nearly 7,000 have died. So you can instantly see just from those figures alone how the future of healthcare is going to be so important for the sustainability of nations. And of course, we've linked this in with Sustainability Development Goal 3, which is so important because the economic viability of countries and populations is only possible when you've got a healthy population. It's so interconnected that without the health and wealth of a population, you will not get economic viability overall. And the experience and the outcome that patients receive influences a lot of healthcare and where people go to in countries where you can choose where you have options for healthcare. And of course, in those where you don't have that choice as well. But that experience and the outcome of patients is absolutely crucial in line with our sustainable development goal. And what's been absolutely paramount to me through the development of this standard and through all of our experts is how we need to protect quality. When we have these demands and these triple threats of decreasing money, low workforce numbers, and increasing demand, it's very easy for quality to be forgotten. But quality is what underpins all of this. That's what keeps people safe. That's what stops people getting harmed. And that's what helps people live longer, healthier lives, which improves the economic viability of nations at the same time. So this is transformational. I can't emphasize how important the introduction and the implication of introducing this standard is going to be. And as we've heard, it's applicable to any size organization. It doesn't matter if you've got one person working in your healthcare organization or 500,000 people. It is just as important any size. And of course, what's even more important associated with this is the continuous learning that we take through adopting the standard and the standards development again in 5 years' time, and using what we've set out within ISO 7101 of our quality improvement cycle of PDSA, Plan, Do, Study, Act. If you're not doing that already, it's absolutely crucial. And that's what this standard has continuously been built upon. So the power of standards is so crucial to the improvement of the world. And as you've heard, and as Dr. Lallu really kindly introduced, we've brought together a working group of over 40 countries, incredible experts from so many different parts of the world who have been absolutely passionate about the development and the improvement of healthcare quality. And Angela and I set out a bit of a strapline when we started this work. And I'm really proud to be sat here now saying how true this strapline was. And that's for the world, by the world. And we have delivered on that strapline that we set out from the very first moment that we got together. And I think that is incredibly powerful, that this standard is for the world, but created by the people of the world as well. And, I picked up a question earlier on the system about conformity, and picking up on what BK was saying about conformity as well. So I just wanted to let you know that there is a conformity assessment standard coming out very soon, ISO 17021-15, and that is competence requirements for auditing and certification of management systems for quality in healthcare organizations. It's a bit of a mouthful, but that is going to be a really important standard for the work that everybody's been talking about, and how we ensure that there is that competence and that conformity to our new wonderful standard on healthcare quality. So I'm really excited now. This is the start of the journey again. We started this journey, as everybody said, a number of years ago to develop the standard. That journey's finished. The standard's there. We're starting a new journey now of implementation and getting everybody to use it. And that is so exciting. And I'm really, really excited to see the legacy of all the amazing people that have been part of this work coming to fruition, and then starting to see the impact that we have on patients and populations in every country of this planet. And that's really important now. We've got, in a post-COVID world, people that are really affected from COVID. Quality was diminished quite a lot during that time, quality of life more specifically. And we've got some terrible atrocities taking place around the planet at this moment in time, which impacts severely on healthcare and the quality that people can have in their lives, and what healthcare can do to support them. I've just read this morning that there's massive power outages across the Middle East at this moment in time. And sometimes we don't realize, but how many people are going to be affected by that from an operation renal dialysis, just having a simple procedure done or a diagnostic or an investigation can be severely impacted by the loss of power and the devastating wars and conflicts that are going on in different parts of our world at this moment in time. And that's why this standard's so important. It's about raising the bar of quality, introducing what all of our experts have said is quality. You know, that's a really simple thing for me to say, but all of the experts have decided quite appropriately what quality means and what quality should be in every part of this planet. So the call to action for you, some questions for you to consider for the 244 people that we had on this call overall. And thank you all for joining us. So the questions I'd like you to go away with are, what can you do now to work towards meeting this standard? And will you now adopt all of the great work that's been suggested by our global experts? And finally, will you share your experiences today to promote the Sustainable Development Goal 3 and to promote ISO 7101, our world's first standard on quality in healthcare? That's my call to action to you all. A huge thank you again to everybody for being here today, supporting today, presenting today, and my love and admiration to everybody who's part of the working group as well. Thank you all so much. And back to you, Dr. Lallu.
Thank you so much, Professor Adam, Layland. We do commit ourselves to adopting to the standards, the beautiful standards that the globe has developed together. So there are some questions that I thought I'd put it across to you, Professor Adam and Angela. Dr. Adam, how do you position ISO 7101 vis-a-vis other accreditation programs like JCI, for example? This is from Rakesh Verma.
It's a really great question. So, you know, how do we position it against other accreditation programs? I think the positioning for me is this is the world's first international standard for healthcare quality. And that is because it's been brought together by everybody in the world. I think that speaks volumes. I think that is the most important position of this standard for us to be able to say, it doesn't matter what country you've come from, no matter what healthcare organization you've come from, we know that this is applicable to you. And there's not many standards out there that do that. There's some amazing accreditation programs. There's great things that are going on with loads of organizations in the world. And everybody's been involved in the development of this standard. So it should all start to align together really nicely. I think that's how I would position it in that sense. But thank you for that question.
Thank you. Thank you so much. There's another question, and this is from Ecuador. Carlos Flores has asked this question. I would like to know if there is any short-term plan from ISO for auditor training in this standard.
So ISO doesn't necessarily do training for auditors that I'm aware of, unless any of our experts tell me otherwise. But so that comes down to both national standards bodies and supporting audit training. It'll come out of the ISO 17021 Part 15 of our conformity assessments that will give those requirements to auditing and certification. And then there's some amazing organizations that are on the call as well that do that training and that do that support to become a recognized auditor and certifier of ISO 7101. So this is brand new. It was only published last week formally. So I imagine the likes of BK, the likes of Dr. Lallu and Carlos and Shin with their organizations are going to be working on that training very, very quickly.
Thanks for that. We will certainly do that. We have a question from Sneha. Is there any booklet in which we get to know more about these standards?
Really great question. There is indeed. So I will post into the chat two things. I will post into the chat the link to the International Organization for Standardization's post about ISO 7101. And just to big up the British Standards Institute a little bit, of course, we have done an executive briefing document associated with the introduction of this standard as well. So I'll post that link into the chat also.
That will be very helpful. For want of time, I think you've already posted, Professor Adam. Yeah. So the link is posted already, dear participants. You can use that link and get to know more about the standards. So for want of time, I would like to now open the session shortly, briefly, if any of the experts want to have a last comment. Over to you, Angela, Dr. Rana, Shin, Carlos, Anu, if anybody wants to say anything.
I was just going to add that when you look at the standard on the ISO page, you can look at a detailed table of contents. So if you want to know exactly what's in it, it'll give you, and it has arrows, and you can open and see each little requirement section that there is. So that's quite helpful as well.
Thank you. What we will all die, and it's time to lend a hand to life, the greatest gift of all. We can't go on pretending day by day that someone somewhere soon make a change. We're all a part of God's great big family. And the truth, love is all we need. And that's the love that has brought us all together. The passion for quality, patient safety, and accreditation. I think we have really miles to go and to contribute to this beautiful world. Thank you all for taking your time. Thank you, dear experts, for giving your time. And
Thank you everyone. Lovely.
Thank you.
Thank you.